a judges panel of top leading healthcare industry experts to help select these patient leaders. And we got to thinking, healthcare is honoring these patient leaders, but there's no awards that the patient leaders are honoring the healthcare companies that are really driving patient centricity, that are really rising to the top. So last year, in collaboration with World Congress, we kicked off our first annual Patient Choice Awards. And these awards, I forgot about the slides here. Nope, maybe not. All right. These awards are to honor, okay, anyway, we'll get those fixed. They're to honor healthcare companies who really are, like I said, rising above and meeting the challenge of patient centricity. So this year, we had 18 nominations, and on our side, we curated 20 patient leaders who went through these nominations. These patient leaders have inspiring stories. They're working so hard to make a change in healthcare. Patient leaders like Candace Lerman, who started advocating, thank you, after researching and using an off-brand chemotherapy drug to put her rare disease into remission. And if that's not enough, she went into law school and now uses her degree and her advocacy to collaborate with companies and to push forward legislative change in DC. Patient leaders like Rick Davis, who started the Answer Cancer Foundation, who holds 19 in-person support groups a month, and that's in addition to the online, always peer-to-peer support that's online for his foundation. And the award-winning Natalie Beavers, who has a 501(c)(3) foundation specifically for epilepsy patients and caregivers, and she's a published author, and her book has been published in more than 7 countries. So this group of leaders really knows their patient communities. They're the ones that are talking day in and day out with the patients. They know their troubles, their struggles. They know the gaps that are out there. They know the resources that they're using. So looking through that lens and going through all of these 18 nominations, they really brought a lot of knowledge and really brought the voice of the patient communities behind them. Now, I could talk all day about the value of these patient leaders, but I actually would like you to hear from one yourself. So I would invite Casey Cashman, who is the director of the Pediatric Pain Warriors for the U.S. Pain Foundation, up to share a little bit more about her story.
Okay, sorry about that. Thank you so much. So thank you guys. Good evening, and thank you for having me here. I am truly honored to be here and speak on behalf of the U.S. Pain Foundation, but more importantly, to speak about my story. I am the director of the Pediatric Pain Warrior Program with the U.S. Pain Foundation. For those of you that do not know, U.S. Pain Foundation is one of the leading patient advocacy organizations for people with pain. It is created by people with pain for people with pain. And the organization works to enhance the quality of life for people with pain and improve the outcomes, address access and affordability issues, and increase public awareness and empathy for the issue of pain. As so many people know, pain comes from so many different conditions, so it's really kind of, it goes across so many different spectrums that we really need to figure out how to better handle that. So my pain story began in 2011. I was diagnosed with complex regional pain syndrome in my right foot. At that time, I was unable to put a sock on, I was unable to put a shoe on. The slightest little bit of air could not touch my foot. I didn't know what to do. At the time, I'm a single mom. I had an 8-year-old at the time, and my life had changed. I didn't know what was going to happen. Not being able to walk, I had to wear a boot. What was I supposed to do? Started looking around, as so many people do, as so many patients do. I started looking for the answers. Had the feelings of hopelessness and worthlessness, and wondered, how was I going to survive this? And it's crazy, because that just started in my right foot, and to now think of where I am, which we'll get to. But I searched and searched and searched. Finally, I found some treatments that were out there that worked for a short while, and I did a hyperbaric chamber, and that gave me some relief. And at that time, I was actually able to run a half marathon. So I went from not walking to then running a half marathon. And the funniest part about it is my girlfriend and I, when we were running, she said, Casey, we haven't trained for this. She said the farthest you've ever run is 8 miles. Half marathon is 13 for those of you that don't know. Yep, those extra couple miles are a big difference. So I said to her, no, Justine, it's fine. We can do it. For all I know, next year, next month, I won't be able to walk. Never realizing that that was the end of my story. And that not the end of my story, that was the end of my running days. The last time I ever ran was when I ran the half marathon. She literally at mile 10, sitting there like massaging my calf muscles, like, you can do it, you can do it. But I completed it, so that was the exciting news. Thank you. So after that, more conditions. As so many people who live with chronic pain and have different conditions, more conditions ended up arising for me, and I ended up being diagnosed with Ehlers-Danlos syndrome, which is a genetic condition, as well as postural orthostatic tachycardial syndrome, which means that I have very low blood pressure. And from that, my life then, as I really knew, completely changed. Went from being so scared, what was I going to do again, spending so many days in the hospital, feeling so lost and abandoned, and thinking, there's no treatments out there, there's nothing out there for these chronic pain patients, there's nothing out there for me, there's no cure, what am I going to do? How am I going to live the rest of my life this way? Well, as a single mom, as any of you can imagine, living in pain was terrible. But now taking away my ability to be a mother was the worst thing that could have ever happened to me. I am so thankful. I have a huge support system. My family has been my rock. My family and my friends are truly what have gotten me through this. But I literally looked over at my son and I said, I've got to fight this. What am I going to do? I have to pass. I have to win. And that's what happened. I realized no one was going to advocate for me better than me. No one was going to find and create support other than me. So I found nonprofit organizations, as so many of us do, and started volunteering for them. So when I started volunteering my time to help others going through the similar situations, suddenly I found myself feeling empowered. I found myself feeling that I'm making a difference. And it was amazing to me to be making a difference for others. Excuse me. And then to find out the difference that what we think is the most horrible situation, somebody always has it worse. And then knowing that your story is helping to empower others. In doing this volunteer work, I had met parents whose kids were going through the similar situations, and they looked at me and they said, you are our role model. I'll never forget one of the first patient education days I did was I had a mother of a girl who was probably 9 years old, and she has some of the same conditions I do, and I was in my 20s, and she looked at me, tears in her eyes, and she said, you've given me hope that my daughter is going to have a life. You've given me hope that my daughter is going to be able to succeed, and my daughter is going to be able to get through this. I'll never forget that day. Still friends with them to this day, and luckily her daughter is doing amazing. But I realized that we truly can make a difference for one another. So in 2014, I discovered the U.S. Pain Foundation when I was sharing my story at a patient education day in the industry. They were there sharing their story as well. And that was a day that changed my life and gave me the new meaning to what I was going through. As someone with so many rare conditions and different disorders, it was wonderful to find an organization that addressed them all. I quickly learned about everything that U.S. Pain has to offer. At first, I was asked to participate in the organization's flagship program, which is the Invisible Project. For those that don't know, the project tells the patient's story through the use of photography. But it gives the entire patient picture. It is a magazine that's published, as well as displays that we take across all industry. We take it to different medical conferences, we take it to doctors' offices, and to policymakers, and most importantly, to the patients, so they feel like they're not alone. They can relate with other people, and they know that there is hope that is out there. After joining U.S. Pain in a volunteer leadership position, I learned even more about their programs, like their network of support groups, both in person and over the phone, led by licensed social workers. They also hold educational events, like long day workshops all around the country. as well as webinars on topics ranging from mindfulness to insurance denials. They develop materials and websites to help with credible information to the patients and their loved ones so desperately need. As we all know, trying to find that, we could all WebMD ourselves, and it's not a good thing to do. I don't recommend it for anybody. But finding a reputable organization was so key in my journey, and so we want to make sure that we're there for others as well. So these were just a few of the examples of things that US Pain has done. As I mentioned, I'm a single mom, so my son would travel with me to a lot of these to a lot of these events. And he realized just how one person truly could make a difference. He met other kids that were going through some of the same stories that I had. So Tyler met all of them, and he found comfort in hearing their stories and then sharing our story at the time. And he felt empowered, and he felt energized, and he felt validated about everything that was going on. And at the time, at the age of 12, he created a fundraiser called Points for Pain. And I am happy to say, in the past 3 years, Tyler has raised over $100,000 for children living with chronic pain. It was quite remarkable. He was recognized by the New York Yankees. We live in New Jersey. So he was recognized by the New York Yankees, and he won their Hope Week Award. He's won several other awards for just being a 12-year-old kid who truly is out there trying to make a difference for these children. From that fundraiser, we then created the Pediatric Pain Warrior Program. This is a vision of my son's through the US Pain Foundation. So through that, we have launched this program. With this program, we helped sponsor a summer camp for children living with chronic pain. We held our first ever retreat, which we held down in Disney back in November. We had 42 families come, and we did a patient education day, and we're offering the ability for these kids to be like other kids, to meet other kids who were going through the same conditions as they were. We've published 2 Invisible projects, both based on just the pediatric versions. As well as webinars. We've done a new Pen Pal, which is like, we call it a Pain Pal. It's a Pen Pal program for those individuals so that they can have that interaction with other kids. And just to share 1 or 2 of these comments was, we laughed, we shed tears, bonded together with new and old friends in ways only people living with pain can understand, and celebrated the warriors and their wins. We're grateful as a family to have had this opportunity to be included. We cherished every moment of the event and look forward to the ripple effect in the future. Thank you to everyone who made this memory and a special weekend. And then 1 more was, Casey and Tyler, I can't begin to tell you what this meant to us. The invaluable information and the conference itself, the beautiful new friendships we forged, the deepening of current connections, the overall camaraderie, and the downright fun will never be forgotten. For anybody who's in here as a chronic pain patient or any type of a patient, you know what it's like to finally get people who understand you, to finally meet somebody who knows, who's walking in the same shoes as you. And for these kids, they are so used to being bullied, and they are so used to being excluded. And we had one little boy who on the video said, I finally feel like I'm part of the in crowd. You know, and then we have other kids who don't get to go to birthday parties. At the camp, we had one family whose little boy had never had a birthday party. We were able to throw him a birthday party. His birthday just happened to fall the same week as camp. And we were able to throw him a birthday party. You know, and for these patients and these little kids, it just is invaluable to them. So, but these are just things that patient organizations make possible. The hope and healing they can provide. I've often said I was given these different conditions for a reason. I never imagined that my son would feel the same. One piece of this missing puzzle is that I didn't mention is my son has now actually been diagnosed with some of the same conditions I have. And he's visually impaired, and he is losing his sight. So he is 16 now, and he is learning how to navigate this world visually impaired. But I'm fortunate enough to be familiar with and connected with so many incredible patient organizations which are helping him and me on this whole new part of this pain journey. And he's been able to look at me and say, okay, so we've been given this hand, but we're going to be able to push forward and move forward. All the ups and downs of the past 9 years has brought me to stand before you all tonight, to share a part of my story with all of you and make you realize how important the patient story is in this process. While my story may be different than most, we all have the same underlying themes in our stories, the depths of our struggles and our pride in our hard-earned triumphs. In life, the only thing we can offer to one another is ourselves in our story. No one can tell our story like we can, and no one can change our story like we can. US Pain is just one example of many patient advocacy organizations helping patients share their stories and take control of their health. Each organization provides unique services and support to its community, help that truly cannot be found elsewhere. The beauty of the patient organizations is they are run by people with pain. For ours is run by people with pain who know the most need because they live with these conditions every day. Now more than ever, patient organizations are vital to public health. Patients across the country face incredibly high and rising health costs, along with increasingly complicated insurance policies and barriers to access. At the same time, we have overburdened healthcare providers, many of whom are too pressed for time to offer the comprehensive help complex chronic patients need. And while today is a time for great intervention in research and care, there is also an overload of information that patients are often led to interpret and understand alone. It can be very overwhelming and bewildering. Patient organizations fill this crucial gap. They provide credible information and reliable education. They often offer support and community for the emotional and social impact of chronic disease. They empower patients to take charge of their care and understand how to advocate for themselves, whether in the doctor's office or on Capitol Hill. So while I know I spoke of US Pain Foundation and all the work they're doing, there are plenty of other great organizations that are out there making a difference, and I'm honored to be standing here in front of some of them tonight. So together we can and are making a difference, one patient and one patient story at a time. So thank you, and congratulations to the award winners tonight.
Thank you so much, Casey, for sharing your story. I gotta tell you, I have the best job out of everybody here because I get to work one-on-one with patient leaders just like Casey every single day. It honestly just makes life worth living to me. All right, so let's get into our awards, and I want to take it back just to those patient leaders who were on our judging panel, just like Casey. Think about the breadth of knowledge that they bring. Like she said, she's connecting with all of these families, these children's families going through pain. All of these judges are connecting with patients. So if I could say one thing to the winners today, I hope you realize how much this award means to patients and how much there's just, this is a thank you for all of your hard work. I know that each and every one, at least on the judging panel, wishes they were here to give you a hug in person. All right, so what am I gonna do? I'm gonna read you the award description that we sent out for our call for nominations, and then I'm gonna call each award winner up, and they're gonna give a little brief summary of their program and accept their award. So the first one, Excellence in Patient Engagement. The winner of this award will be an innovative initiative designed to create innovative, scalable strategies to improve patient engagement and optimize medication adherence. The project will offer interdisciplinary ways to co-create health solutions that engage and activate patients to be an active participant in their health management. The initiative may include, but is not limited to, a health literacy campaign, adherence intervention, digital platforms, framework, or social support programs that will deliver tangible improvements in the patient experience. And this year's winner is AstraZeneca with their Patient Partnership Program. So, with the creation of the Patient Partnership Program, AstraZeneca now has the opportunity to hear the real-world experiences of individuals who have been impacted by their diseases. This program was created in conjunction with a team of patients across a variety of therapeutic areas to ensure the compliant, open line of communication between AstraZeneca and the patients from around the world who are knowledgeable about their condition and who are influencers or advocates in the community, allowing the co-creation of patient-centric products and services. So please join me in a round of applause for AstraZeneca and their patient partnership program. Oh, sorry, there's not enough room here. Here. That's enough. Go. Come over here. Thank you very much. I know.
Thank you very much. It's really an honor to be here this evening, especially following such shoes as Casey. So thank you for your story. Amazing. The recognition of the Patient Partnership Program is not something I thought we would be doing, because 3 years ago, this initiative really was born out of a need to kind of change patient centricity from a buzzword in our organization to a mindset. We realized that to really truly make a difference, we needed to establish really an open, sustainable engagement with patients, as well as their carers, their full ecosystems, so that we could learn from each other, so that we could co-create solutions that truly would improve patient experiences and ultimately health outcomes. So we started small. The program had initially in the pilot phase two disease areas. We had asthma and ovarian cancer. We had like 5, 6 patients in each of the programs. These were patient experts that really truly bring a level of knowledge to be able to help us co-create. They sit as colleagues at the table with us when we're designing programs, when we're reviewing clinical study protocols. I mean, every step of the way from early development all the way until the launch of a product and beyond, we are incorporating the patient voice at all steps. And I'm really proud to say today that the Patient Partnership Program encompasses 12 disease areas, comprised of about 120 patients worldwide, in order to get that kind of breadth of healthcare system, the breadth of cultures. We really are spanning across the globe. And we now support about 100 projects a year, actually a little over more than 100 projects a year across our global organization. So today, a really heartfelt thanks to WeGo Health and the World Congress for recognizing the importance of patient engagement. And really this award is dedicated to you guys, anybody and all of us who are patients, because we're really the ones whose voices, patients are really the ones whose voices are changing the healthcare system and ultimately outcomes and how we move forward. So thank you again and enjoy the rest of the Congress.
Congratulations. Okay, moving into our second award, Most Influential Patient Advocacy Collaboration. The winner of this award will be a collaboration which significantly elevated the patient voice in critical decisions made internally and externally that significantly impacted patients' lives. This collaboration will clearly bring a mutual beneficial value proposition to both stakeholders and leverage the qualities of each partner involved to ensure patients are heard and empowered. This initiative would demonstrate meaningful ways to engage the patient voice, gather real-world understanding of the burden of disease, and incorporate patient perspectives to ensure the patient voice is championed internally and heard externally. The partnerships may span from working together to forge disease education, promote clinical trial awareness, change public policy initiatives to increase access to quality and care, or to ensure that patient perspective is always represented. And this year's winner for our Most Influential Patient Advocacy Collaboration is Sage Therapeutics for their Planning Beyond the Baby campaign. Postpartum depression, PPD, is the most common medical complication of pregnancy, yet more than 50% of cases go undiagnosed without proper screening. Many women are suffering in silence as they are not aware of the symptoms of PPD and the shame for the way that they are feeling. The SAGE PPD Disease Awareness Campaign, Planning Beyond the Baby, strives to activate the online community to change the PPD conversation from stigma to empowerment. The campaign was formed in collaboration with expectant moms, new moms, and former sufferers of PPD. Success was reached as both the click goal and sharing hub visit goal was hit ahead of schedule, achieving 53,000 clicks, 44,000 visits, and reaching over 1.2 million women. So please join me in congratulating Sage Therapeutics on winning the most influential patient advocacy collaboration.
Thank you very much for this opportunity. I've been with Sage Therapeutics for about a year now, and if I had the opportunity to work on this really impactful project, for me it has deeper meaning than just working on a disease awareness campaign. It's more about the women in the community that we served. It's a true honor to do work that serves the mamas out there in the world. I myself am a mom of 2 toddlers, and for me, the meaning is personal. As my firstborn was a preemie, I was in and out of the hospital as of 18 weeks. And it was a high-risk pregnancy, and was told at 18 weeks, sorry, if you don't make it to 24 weeks, there's something we can do about this. Preemie moms and moms of high-risk pregnancies are a much more greater risk of having postpartum depression. So it has personal meaning to me, has personal meaning to my sister, who also had suffered from similar issues with her pregnancy. So I find the work that I do at Sage very gratifying, and I'm really glad to be able to bring to light, help other women recognize symptoms of postpartum depression in themselves and in others that they know. I want to give a special thanks to all of the mamas that share their stories. We're able to reach, as you heard, a number of women via social media, and they shared heartfelt stories about their own experiences, and helped raise awareness amongst the community. I also want to thank our partners at Weibo Health, our review team, for being able to make this happen. As it's not, Sage is actually a new commercial organization. Our PDUFA for our product for postpartum depression is next week. So we're at the brink of commercialization, and so a lot of this is there's a lot of firsts for our company, and our review team was able to do a first for social media for us, and being able to work within a regulatory environment. I wanted to share one of the stories from one of the mothers that have responded to one of our social media posts, and it just illuminated the type of work that we're doing. This is a great topic and should be discussed more often. I went through postpartum depression, but I was told by several people that it was just baby blues and I would be fine. I never sought out help and ended up enduring almost 2 years of depression and intense anxiety attacks. I had a very difficult time bonding with my baby, and was dealing with the guilt of that and thinking I was going crazy. I finally got the help I needed long after I should. If you are postpartum and you think you may be experiencing baby blues, please talk to your doctor. Don't wait or think you can handle it on your own. It's bigger than you, and there is help. Thank you very much.
What I love about these awards is that every single one of these campaigns, all 18 nominees are really making an impact out there for thousands and thousands of millions of patients. So thank you so much and congratulations. So last but certainly not least is our Patient Centricity Trendsetter Award. So this award will be given to an individual who has gone above and beyond to lead internal initiatives that promote a patient-centered culture and forge collaborations with key stakeholders to promote and enhance patient experience. This individual will show an advanced commitment to engaging patients and establishing valuable relationships within the healthcare landscape to make a difference in patients' and carers' lives. So this year, our Patient Centricity Trendsetter Award winner is Damian Johnson, the Director of Patient Engagement and Advocacy at GSK for the Us and Lupus campaign. The SL Lupus campaign is a highly successful disease education program designed to provide SLE patients with the tools and support necessary to take a more active role in managing their lupus and communicating with their healthcare team. When evaluating participation in the program, GSK uncovered African Americans only accounted for 20% of the registrations. This was concerning as SLE disproportionately impacts African American women 3 times more than their Caucasian counterparts. The Us and Lupus Women of Color campaign combined a social media campaign via Instagram, Twitter, and Facebook, as well as grassroots initiatives in 10 key markets. Success was reached as they surpassed their click goal by 65%, and the campaign helped to increase African American registrations of the Us and Lupus campaign by 7%. So please join me in welcoming Damien onto the stage to congratulate him for his award. There's not enough room.
Thank you so much, I appreciate it. No, that's fine, I'll wing it. First, thank you so much, World Congress, as well as WeGo for this award. This is extra special, and I actually flew just for the day to receive this award from North Carolina because it actually came from patients. And I thought it really important to acknowledge that and be here today. And so, you know, I really want to accept this award on behalf of the really resilient lupus warriors that I have the privilege of serving and I've had the privilege of getting to know both professionally and personally. And many will never understand and know all that they deal with because in many respects they suffer in silence. Many of these people feel very isolated, and it is a pleasure to serve them and tell their stories, to create an environment where there's a greater awareness about lupus, but they can be much more confident and much more proactive in the management of their disease. And so we've done that in several ways, and one of the things I wanted to just kind of mention, and I'll tell a very personal story associated with it. So if you see these pictures, there's a panel discussion, and at the bottom you'll see there was a news coverage on an event that we created called Night of Beauty. And so for those of you who may not be aware, many lupus patients, there are some who suffer from pretty significant skin pigmentation issues and scarring associated with their lupus. And so many of them, as you can imagine, 90% of people that experience lupus are women. So you can only imagine being a woman in your childbearing years, 18 to 44, and you have these pretty significant scars on your face, may suffer from alopecia. And for many of these women, again, they feel very isolated and they're not transparent, not only with their loved ones, but they're not transparent with their physicians. And that is very problematic. The average time to confirm diagnosis is 5 to 7 years for these patients. And so what we wanted to do was to create an event where we really emphasize self-care and people feeling empowered and confident and building self-esteem. And so we actually are going around the country closing down Sephora cosmetic stores, and we're partnering with NARS Cosmetics to come in for a day of pampering. Women get free makeovers from NARS Cosmetics. There's a panel discussion talking about the importance of self-esteem, talking about the importance of building a healthy relationship with your healthcare provider. But all in all, I just wanted to mention one quick thing. So we just did an event at Pentagon City Mall in DC. We'll be at King of Prussia on next Tuesday. But a young lady stopped me to thank me for having the event. She grabbed my hand and she said, "I'm going to try not to cry." And it was a bad sign. But she says, "My mom died of lupus in 2004. I was diagnosed in 2017, and I've been in denial until tonight." And so she saw the event on being held on through social media and decided to come out. And this was actually the first lupus event she went to. And she said that it finally gave her the encouragement to be able to be vocal and to ask for help and to make people aware that she was suffering in silence. So for all that we do, you hear stories like that, it makes it more than worthwhile. And so I just want to thank you for this acknowledgement. I accept it on behalf of those Lupus Warriors. Thank you.
Let's give all three winners just one last round of applause. Congratulations. I may be standing up here, but this is really the patients saying thank you so much. So thank you everyone for attending. I hope that you will join me and grab a drink to toast to these three award winners right out in the networking cocktail hour. So thank you so much.